Hi guys, Anita Buffem here. Welcome to Buffem Beautiful. I'm with my producer today, and we're going to have a discussion because you have it all put up.
We have a lot of inquiries.
Yeah.
About your recently you posted a picture where you were wearing a little brace or piece of tape over the bridge of your nose.
Yes, honey.
And there are a lot of inquiries about your plastic surgery, your extensive plastic surgery, and I thought we'd clear that up for everyone.
Well, I did just recently have my nose done. Is that what you would say?
No.
I had it fixed. It was not cosmetic. It was medical.
It was a deviated septum.
And I know that's what they all say, but really, I had that. When I was a kid, I was playing outside in the snow. And we were digging through a snowbank, and my friend on the other side came through with a shovel and bam, right in the face. So, and I didn't realize this until I went to the doctor, and I also had been dealing with sleep apnea. And there was a little questionnaire on this form for this doctor. What did I go for? Oh, I went to have a mole removed. That's what I went for originally. And there's this questionnaire on there. See, they always get you. You come in for one thing. It's like going to get your car fixed, right? So I get in there and fill out this questionnaire. And one of the questions was, do you suffer from sleep apnea or severe snoring? Well, I suffered from sleep apnea. So I get in there and he's like, so, sometimes people suffer with sleep apnea because they have a deviated septum. Let's check. And he did this little thing where I inhaled through my nose and my nose collapsed. And so that means that there's a block there. So even with the sleep apnea mask, it wouldn't be working because the air that blows in to your face from the sleep apnea mask is just hitting a wall inside your nose, and the air goes nowhere. So they went in and they fixed it.
Great.
It was very easy. Dr. Sang Kim out of Syracuse. He's fabulous. I think he
did not have to cut you open.
He did not have to cut me open. I didn't have to have the flip thing, but he did have to break my nose and do some stuff in there. And then, so I went. I guess I should tell you all about it because if you have to have this done, I know a lot of people have to have this done. It was very easy. I went in, and they prepped me for the surgery, or whatever, and I was out, gone, down. Didn't even remember. Didn't know nothing was going on.
Kind of like when you ask for those 2 pills at night with your martini.
Well, yeah, I have those at night because I need to sleep. That's a horse of a different color. I wake up and I have this contraption around my face. It's like goes under my nose, around my ears, and I didn't feel anything. Everything felt fine. I didn't have any pain really, and I went home and was very congested. Couldn't breathe through my nose for about a week or two. It was very congested. And what week are we at now? 4?
5 almost.
5 weeks ago I did this. So, what else do you need to know? It was 3 days of me doing absolutely nothing. You have to be very careful. You can't do nothing for 6 weeks. No working out, no running around, no sleeping with your head face in the pillow.
Couldn't blow your nose.
Can't blow your nose. You have to use saline mist to clean out your nose, and you put Aquaphor in there. Every 2 hours, that's what it was. Every 2 hours for the first week. And everything's going well, though. I can breathe. I still have a little bit of congestion. There's a lot of unbelievable things that come out of my nose, which I won't describe to you here because it's disgusting. But I'm doing well. I'm excited about it. And next up is my eyes.
Oh, is that cosmetic or
May
corrective?
11th, honey.
Is that cosmetic or corrective?
A little bit of both, honey. Insurance is covering it because you see how exotic my eyes are? But when I smile, I can't see out of them. So they tested my field of vision and determined that I'm a candidate to have basically a medical eye lift. So they're going to get rid of some of the fatty tissue in my eyelid and open my eyes up a little bit more so I can frickin' see when I'm driving. Mm-hmm. That'll be good for people, right?
Sure. Well, here's some questions people had.
All right.
Okay. Are those implants?
In my nose?
No.
They're not. It's makeup and a shelf of my skin pushed really tight together. Sometimes I even tape it if I want them to be really, So you grab all the skin and tissue from under your arm, push it all together, and I paint this a light color, as you can see, and I paint this a darker color. easy as pie.
Okay.
And on camera, they look ridiculous.
Have you ever had any plastic surgery?
Just that having that mole removed.
Have you ever had any cosmetic procedures?
No.
Nothing? Okay. Would you? Are you opposed to?
I'm not opposed to it. I think a good like this doctor, Dr. Sang Kim, I can't shout him out enough. I had no bruising, no pain, no black eye. It was amazing. So a good plastic surgeon, he said to me, all right, while we're in there doing this for your nose, do you want us to do anything cosmetic? And I said, well, I wouldn't mind if you made my nose a little cuter. And he said, well, to be honest, I think your nose is as cute as it can be. So, and I think it's good because I don't want the doc to just pile it on services for his own pocketbook, you know? So I like that. So my nose doesn't really look that much different. It's a hint straighter. And apparently it takes a year really to see the full difference. So we'll see what happens. But so far, everything looks normal and everything looks good.
All right.
So yeah, thanks for joining me. If you have any questions, leave them in the comments below. Please follow me here on the YouTubes and on Instagrammies and the Facebooks and all that. Just Anita Buffem. And be sure to lead with love and positivity, and you will be Buffem beautiful.